Good morning. Come in, we are open. Good morning, good morning, good morning, good morning. Good morning. Hui. A most wonderful good morning. Good morning. A most wonderful good morning.
I sent you an email, but probably you haven't got it. I just wanted to ask, for the optional lab next week, is it the same slots in which we had our practical?
Let's talk about that.
Oh,
That's why I didn't respond.
oh okay.
Sorry.
Oh, no, sorry, yeah. Sorry.
It's not next week. No. We are in week 16.
Oh, is it the week after? Oh,
Most wonderful good. Yeah, thank you. Good morning. Good morning. A most wonderful good morning. Most wonderful good morning. Most wonderful good morning. Good morning. Most wonderful good morning. Good morning. Good morning. Good morning. Most wonderful good morning. Most wonderful good morning. Good morning. Good morning. Shall we make a start?
Karen is okay,
Sorry?
yeah. Karen is okay, yeah.
Oh my God, what happened to him? Missing in action. I'm sure he will turn up at one point.
Yeah, no, I think he's coming now.
Oh, okay, good. Or he just has abandoned you.
He wouldn't do that.
No, I
He
know.
wouldn't.
I know, definitely not. Shall we make a start? A most wonderful good morning, everybody. As per usual, a couple of announcements before we get into really hardcore biochemistry. I think quiz 2 for BI 301 for this module is still open. Correct me if I'm wrong, but I think the deadline is a week Sunday, so it's the 16th, if I'm correct. Does that tally with what you know? Yeah? Camus goes like that, so it must be true. Good, excellent. Please don't forget to log your attendance on Moodle on your devices. Do it rather sooner than later, because later you'll forget. And if people don't log their attendance, then the senior tutor is going to have a word with you for not attending. And it wouldn't be fair because you're attending, but yeah. Right, now I hope you enjoyed the practical this week. I think it was a very gentle, very easy practical. And I think it reflects sometimes the scientific progress. Experiments are sometimes not terribly spectacular in terms of, you know, what you do. It's not all singing and dancing and terribly complicated stuff. The true thing then comes with analyzing the data and what the heck is that telling me? Is it telling me anything? Or maybe not. Very often I hear from postgraduate students, or from final year project students, I'm so bored and, you know, things don't really work. All I can say is, welcome to my world. As a researcher, please don't be under any illusion, but I would say 90% of the work that you do, of the experiments that you do, 90% goes straight into the bin. Yeah? 10% are interesting. And with interesting, I mean, it doesn't necessarily tell you what you wanted to know. It's a little bit like you ask a question. You ask the experiment, because that is what you do with an experiment. You ask the experiment a question, is it black or is it white? And the answer is 42. And you think, that was not what I asked. But actually, what happens is, if you get something like that, you ask the wrong question, right? So the unexpected things that are quite often the interesting ones. And these are the ones that could potentially make you famous. So don't disregard anything where you think, oh shoot, that didn't go down too well. So it probably doesn't come as a surprise to you, with that in mind, that for the practical that you just done, there will be quite a bit of data analysis. Just to get you into the spirit of being true scientists, and also to practice the tools that you have potentially learned in other modules. Now, you are aware that in week 18, that is not next week, but the week after, there is what it says, an optional dry lab, dry practical. This is sort of, has historical reasons that it's there. I personally don't think we need it, because what I'm currently doing, and I haven't finished it, so therefore you haven't received it. What I'm currently doing is I'm writing a lab report, a model lab report that I will share with you so that you see what I want you to submit in week 19, right? So with all the calculations, with exact instructions, what you have to submit in week 19 and what it should look like. Yeah? So therefore, I don't think we really need, once you have received that, and hopefully you will get this by Friday or something like that, you should see what calculations you should do, what plots you should do, what you should submit in week 19, with all the calculations, with all the trimmings. So I don't think we need this dry lab. However, I'm fully aware that there were a few people, or rather there were not a few people, who couldn't make the lab yesterday because of or on Monday, because of illness, or there were also a few people who got some really, really dodgy data. Now, for them, I would give them the opportunity to do the measurements, either for the first time, if they couldn't attend, or if the data are really dodgy. So I suggest that these people who don't have good data, they come in week 18, and ideally I would say from Tuesday 10 to 1300 hours. Let's keep it open that way. From 10 to 1 on the Tuesday in week 18 to do a repeat of measurements. If people want to do that, please send me an email so that I get an idea of the numbers. Yeah? If your data are reasonable, you don't have to come in. unless you are seriously struggling with doing the calculations, despite my best efforts of the model lab report. Yeah? If you are still struggling, yeah, I will be there. Let's have a chat. But do I want that? Honestly, no, not really. Yeah, I'd rather you try it yourself. Does that make sense? Are you happy with this arrangement? I don't want to deprive you of contact hours with myself, but I'm sure you have better things to do in life. Yeah. I will basically repeat in an email to all of you what I just said, so to make that absolutely clear. Does anyone have any objections to this approach or any questions? No? Everybody happy? Those of you who are watching the live stream, please post something in the group chat if you like, or on the live stream if you are strongly dissenting with this approach. Okay? So, only week 18 on Tuesday 10 to 1 if your data are dodgy. What do I mean by if your data are dodgy? If you've recorded your data table and you obviously need to plot that, and if your data actually, when you plot OD per second versus time, if your data look like a cross-section through the Himalaya, then I would consider that as a little bit of ugh. And if you've got more than one of your graphs looking like that, then probably your data are a little bit dodgy. Yeah? Or if your data, if you do the same thing, if your data instead of, I think everybody saw that the data absorbance went down. If your data do that, right, is exactly what they shouldn't do, again, you know, there is something wrong. Let's do it again in week 18. Are you happy with that? Fantastic. Makes life easier for all of us, and I said I will send you instructions how I want this report to be submitted at the end of the practical in week 19. Right. Great. So, what I want to do with you today is expand a little bit on the inhibitor stories that we discussed last week. That's in the first part. In the second part, we will discuss something slightly different, and we will be in total violation of the Michaelis-Menten equation, but I don't give a whatever because that's an important topic. But coming back to the inhibitors, these inhibitors are really important stuff because entire pharmaceutical company is based on that. And just to illustrate that, I very recently, well actually yesterday, I came across a post from a friend about a one-day short course on molecular docking. And this is actually the basis of all drug discovery. A multi-billion pound business every year. Molecular docking. This is offered by the sort of my second home, the University Technology Malaysia. I've done quite a bit of work with them, and I'm still in touch with them. By the way, if I remember correctly, they are still a partner institute for the University of Kent for bioscience students. So if you are thinking of doing a study a year abroad in a fantastic country at one of the world leading universities, let's talk. If you are interested in that. I can tell you the food is fantastic. And don't worry about central heating. Don't need that. All the courses are, by the way, in English. And people who come back from Malaysia, from UTM, are either broken or absolutely ecstatic. Anyway, this molecular docking, this course, obviously not for you at the moment because you are still here, this is the fundamental of finding inhibitors. How does it work? Well, in the very first place, we need to identify a target. Identify target for drug discovery. So let's say I want to develop a drug. I want to develop a new antibiotic. Let's go down that route. So I've got some bugs that are horrible, and I want to kill them. So I need to identify, is there an enzyme that I could inhibit so that them bloody bugs suffer, but not the host? And that's quite tricky sometimes, because if I want to target an enzyme that is both present in the pathogen and in the host, could be a problem, because it can kill the pathogen, which I want, but it can also kill the host, which usually is not the desired effect. If the host is dead, well, then the pathogen is probably dead as well. So mission accomplished, but it's not nice if you have to take some drugs where you know that they're going to kill you. So you want to have it as specific as possible for the pathogen or for a particular pathway. If we are talking about, let's say, inflammation, you want to develop a new inflammation inhibitor, you would look at enzymes in an inflammation pathway, and you would say, right, that is an interesting enzyme, and I want to inhibit this enzyme. Now, with rational drug design, what you actually do with this method that my colleagues at UTM do is you say, right, I know the enzyme, I know what the enzyme looks like, and I have a three-dimensional structure of the enzyme. You can get a three-dimensional structure either by crystallography or by NMR. So you have a three-dimensional structure. Let's say this is what our enzyme looks like. Here's the active site. And you have a very, very good idea what the active site looks like on a molecular level. So you know that, for example, here sits an arginine residue, here sits a tyrosine residue, let's say, for example. Yeah? And with this rational drug design, what you do, and you have that in your computer, with rational drug design, what you do is you check out, you look at the dimensions of this active site. You basically zoom in and say, what does it look like? Where are sort of contact points with, for example, a natural substrate? So you would use a natural substrate here. which would fit nicely into this site, and the enzyme usually would do something. And then you say, right, I identify on the substrate certain contact points where I think they are important for the binding or for the catalytic activity of the enzyme. So I have 1, 2, 3, 4, 5 contact points here that are interesting. It could be a nitrogen group, it could be oxygen, it could be anything. It could be also something related to the shape. So I identify these points. And now I go into a computer and into a database. And this database depends on, who owns the database, but there are databases with up to 10 million different chemical compounds. And these 10 million different compounds are all characterized with these contact points. So I say, I want a compound that has all these 5 contact points that I identified, all these 5 individual contact points, and it has to have this particular shape and size. So then the computer gives me a list of what is called potential leads. Potential lead compounds. What they have in common is these contact points. What I can do now on the computer is I can say with specific computer programs, I can say try to match this compound, this lead compound, into the active site of the enzyme. And then computer does the docking and says, yeah, actually, contact point 1, 3, and 5, perfect match. 2 and 4, not a good match. And I can optimize now how the computer generates these things. Comes up with new lead compounds, and I say, actually, I want contact point a little bit shifted to the other side. Can you generate a different set of leads? So it is an iterative process, but at the end, you usually end up with, out of these 10 million different compounds, with 5 to 10 different leads. And then you say, and they all would match beautifully. And what you then do is you talk to your chemistry department and say, can you synthesize this particular compound? I want to test it, whether it actually inhibits the enzyme. In the next step, of course, you then look at the compound where you think this is particularly interesting, and you have to make sure that it fulfills certain criteria. So, for example, if the inhibitor is extremely toxic to humans, then it's a no-no. If the inhibitor that you designed is will never reach the target because it is, for example, highly hydrophobic and you want it to work in the blood is a hydrophilic environment, then what you can do is you can say, right, I need to modify my inhibitor. Let's come up with this inhibitor like that, which has the right contact points. I can modify this inhibitor with something else, for example, so that it reaches the right target, it is absorbed properly, it's not toxic. And again, you have a whole library of compounds that you can attach and modify your inhibitor with. And you can then test, does this thing still inhibit my enzyme, my target? Is it still acceptable that it doesn't kill the host, etc., etc. And once you have done that, you would go into the synthesis of that stuff. You would go into clinical trials. And with a little bit of luck, it goes through all 3 phases of, or 4 phases of clinical trial, and you have the next blockbuster of pharmaceutical drug that you can sell. This is what's called rational drug design, and all big pharma companies actually use this approach. In previous years, it was, sort of hit and miss. Oh, you've got a great drug. For example, aspirin. It's a fantastic drug, but up until 20 years ago, we did not have a clue how it actually works. What does it target? How does it work? How does it bind? We now have a little bit of an understanding of that, how it works. And by the way, aspirin or paracetamol, if they were put on the market today, they would not be approved because they have a lot of problems with them. But this rational drug design actually aims to develop inhibitors that can go through that phase. In terms of how long does it take from the original idea to selling the product, you can roughly estimate, we are talking about 5 to 8 years for that. Costs are usually in the range of 1 to 2 billion US dollars. So you have to be pretty sure that your approach works, because otherwise you make a loss. So you have to make sure that your inhibitor is good. Now, what does that mean? What are we talking about? Good inhibitor. How do we define that? Well, let's do a quick revision of what we did last week. We said we have, let's say, a competitive inhibitor. We've got our scheme here. So, and I indicate that with a C, competitive inhibitor. Competitive inhibitor exclusively binds to the free enzyme, and it is mutually exclusive with the substrate. Competitive inhibitor can bind to the active site, and usually that is what drug companies go for, competitive inhibitor, because they are easy to find. If you've got the structure of the active site, you can do the stocking. If you don't have the structure of the active site, you can't do anything with it. We said that a competitive inhibitor Vmax will go down. Oh, sorry. I'm talking nonsense. Vmax will stay the same. Km will go up, and Vmax over Km will go down. That is the scheme for a competitive inhibitor. And it can bind either to the active site or somewhere else allosterically on the enzyme and stop the substrate from binding once the inhibitor has bound. Now, how do we find whether an inhibitor is good? What we really want is the following scheme. EI is in equilibrium with the enzyme and the inhibitor. So this would be our dissociation here. And we can write KD equals concentration of E times concentration of the inhibitor divided by EIC. We want an inhibitor that really, really clings on to the enzyme, that does not dissociate from it. Yeah? Does that make sense? So what we want in the equilibrium, we want this part here to be large. We want these two here to be low. So we don't want a lot of free inhibitor floating around, and ideally all the enzyme should be blocked with the inhibitor. So the smaller our KD, and very often you will find that also abbreviated as Ki, and if it's a competitive inhibitor, it's very often abbreviated as KIC. We want KIC as small as possible. Yeah? Happy with that? The smaller KIC is, the better is the inhibitor. Now, people sometimes say to me, I've got a KIC of 10 micromolar. Is that a good inhibitor? You really need something to compare it to. Otherwise, it's a little bit like saying, what's the difference between a stork? Yeah, they've got two legs, and the left one is, and both legs are the same size, the same length, especially the left one. So if you just simply say, is that a good inhibitor or not, it doesn't make sense. You really need to compare it to something. And if you want to compare two inhibitors and say, I want to see which one is the better one, the smaller the KIC, the better, the tighter binding of the inhibitor. How do you actually find the value for KIC? Well, you do your experiment like you did yesterday in the presence and absence of inhibitor. So let's do an Eadie-Hofstee plot. We say without inhibitor we get something like that. With inhibitor, we know it's a competitive inhibitor, so Vmax stays the same. So that would be plus inhibitor. Plus more inhibitor. Plus even more inhibitor. Vmax stays the same, but what you see is that Km and Km over Vmax and Vmax over Km changes. And what you do with these data is for the different inhibitor concentrations. So you have different inhibitor concentrations, and you determine for each inhibitor concentration actually not Vmax over Km, but the inverse. You determine Km over Vmax, which just simply is 1 over Vmax over Km. It's just a reciprocal that gives you Km over Vmax. And for each inhibitor concentration, you determine Km over Vmax. So you would get this, you would get this, you would get this, you would get this. for the different inhibitor concentrations. And now you can do what is generally called a secondary plot. Because it is the second plot after the original plot that you do, or it's also called a Dixon plot. And in a Dixon plot, you plot your inhibitor concentration, let's say in micromolar, versus Km over Vmax. And that could be, let's say, millimolar per minute or something like that. And what you do with that is you get for different inhibitor concentrations, and don't forget, 0 is also a valid inhibitor concentration. So you can do that also with 0 inhibitor. You would get a straight line. Ideally. And the crucial point, and I think I've got a video where I show in detail why that works, but you don't have to know it in detail, you just have to know what you plot for the Dixon plot. What you get is this intercept here with the x-axis, and this is minus KIC. So you would get a value of, let's say, minus 5 micromolar for minus KIC. And KIC also always has the same unit as this inhibitor concentration. So if minus KIC equals minus 5, then you know that KIC equals 5 micromolar. KIC can only be positive. That make sense? Yeah? So you can find out inhibitor concentration by doing this Dixon plot. Now I can hear you say, hang on, if we have an uncompetitive inhibitor, then Vmax over Km would always stay the same. So if we've got an uncompetitive, inhibitor, we know that Vmax goes down. We know that Km goes down. We know that Vmax over Km stays the same. We know that an uncompetitive inhibitor exclusively works with the enzyme substrate complex by binding somewhere else and stopping the enzyme substrate from being converted into enzyme and product. Now, of course, with an uncompetitive inhibitor, what we would get in our primary plot, that is without the inhibitor, this is with inhibitor, this is with more inhibitor, this is with really lots of inhibitor. We get the same Vmax over Km. So we can't do this kind of Dixon plot. But fear not. We just simply use a modification of the Dixon plot, which is also called a Dixon plot, for the uncompetitive inhibitor. And what you plot with the uncompetitive inhibitor, you plot the inhibitor concentration against, let's say, micromolar. And this time, you plot 1 over your Vmax for the different inhibitors. So basically, you plot these values. So here you would have 1 over Vmax, let's say minute per millimolar or something like that. Then what you see would be ideally a straight line, that it has this little in it. That's just my lack of drawing skills. And again, this point here, this intercept with the x-axis, gives you minus KIU. That's the uncompetitive dissociation constant. And again, let's say this is negative 3 micromolar, so you know that KIU, which again has the same unit as the inhibitor, would be 3 micromolar. Does that make sense? So, depending on what kind of inhibitor you have, you measure either Vmax over Km or you measure Vmax. You use the inverse and plot the inhibitor concentrations against the inverse what you measured. If you have a competitive inhibitor, you plot Km over Vmax. If you have got an uncompetitive inhibitor, you plot 1 over Vmax. And you can determine what is my dissociation constant with these Dixon plots. Next year, it's your turn to find inhibitor constants for some enzymes. Now you could argue, right, what happens if our inhibitor actually is mixed? If the inhibitor can bind to the free enzyme and to the enzyme substrate complex. So that would be a mixed inhibitor. How do we deal with that? Well, IC and IU are the same compound. It's just a representation that this inhibitor can do both. It has affinity for the free enzyme and for the ES complex. How do we find now the inhibitor constant for that? Well, actually, the inhibitor constant for that is composed of 2 components. It is composed of KIC and KIU. So what we can do in this case is without inhibitor, with inhibitor, with more inhibitor. And what we can do is sort of, we can split it, we can separate it, and say, to get the KIC, what I just simply do is I plot my Km over Vmax versus inhibitor, get a straight line, and determine KIC from these data here. And for my uncompetitive component of the inhibitor, I plot the different 1 over Vmax versus the inhibitor concentration and get my minus KIU. So I can say then, I have a mixed inhibitor present, and the dissociation constant for the competitive part is 5 micromolar. The dissociation constant for the uncompetitive part is 100 nanomolar. So in this case, if we are dealing with a mixed inhibitor, we have to do this Dixon plot basically twice. One for the competitive component, one for the uncompetitive component. Are you happy with that? It's a lot to take in, I'm fully aware. And that's why I give you an extended break now of 10 minutes before we move on to the next subject. But I've set up some practice questions for you to try out, do these Dixon plots, and it will come up in one of the next quizzes as well. 10-minute break, okay?